We have a massive struggle in our nation. Hundreds of thousands have died, but we can stop that. Individuals can save lives. And naloxone is a tool for that. And we can empower students to not feel hopeless in the face of this insurmountable crisis, but to know that they can do their part. They can protect their peers. They can reach out a branch of compassion instead of isolation, and they can reach out a branch of love instead of rejection. And that's what I want our education system to do.
This is Countermeasures, brought to you by Emergent, maker of Narcan nasal spray. Join us as we explore the shifting, complex world of the opioid crisis. Today, opioid overdose is a leading cause of accidental death, with so many families, loved ones, and friends behind these lives lost. This season, we'll continue to explore some of the communities hit the hardest by the crisis, from prisons and construction sites to schools and elderly care. We will hear from changemakers offering a new way forward. Students are increasingly at risk of fentanyl overdose. 22 high school-age adolescents died each week in 2022 from an accidental overdose driven by fentanyl-laced counterfeit pills. Across the country, students are rallying together to help protect their peers, advocating for access to naloxone and better education about overdose, the adulterated drug supply, and the dangers opioid misuse can pose. As you'll hear in this episode, students want to participate in conversations about the opioid crisis and its effects, and have become advocates for finding solutions. In this episode, we hear about efforts to allow students to carry naloxone at school, and what young people are doing to address the crisis in their communities. Hayes Stritikus, who you heard at the beginning of this episode, is a student from Durango, Colorado, who has become an advocate for allowing students to carry naloxone.
Durango is a town of about 18,000 people, so we're a very small community. Student overdosed, actually 3 students overdosed, 2 ended up in the ICU, and 1 unfortunately died from fentanyl poisoning. And that kind of kickstarted a conversation in my town about drug abuse and, the dangers of fentanyl and the dangers of the opioid epidemic, which kind of transferred into naloxone and harm reduction work. I was a ex officio student board member. My term ended just about the same time the overdoses occurred. I'm also a twin, and my twin brother ran for class president on a platform of harm reduction and drug education, which was pretty funny because everyone else is running on, better school dances and more activities. And he's sitting here talking about fentanyl test strips and naloxone. The students were very receptive of that, and that kicked off what equated to be about a year-long struggle and conversation between students and our school district about allowing students to carry naloxone on campus, as well as what can be done to better educate students for drug use. Following our success at our school board, our local, my brother and I and a group of other kids founded the organization Students Against Overdose, which I currently serve as a co-director of. And we helped write a bill that made Colorado, and that put in Colorado statute that students are allowed to carry naloxone on school campuses, as well as updating language regarding additive test strips.
Montgomery County Public Schools in Maryland has also adopted a program to allow students to carry naloxone. Dr. Patricia Kapunen, a pediatrician and adolescent health specialist who served as MCPS's school system medical officer, says that the policy was adopted earlier than in other districts, which put the school in a good position to address the crisis as it continues to evolve.
We addressed it at a system level earlier than some other districts who only now are looking at the tragic events and scrambling to respond. We were in a good position because in Maryland since 2017, every school already had naloxone. So we had a little bit of a head start. And when we came out and said illicit fentanyl is a huge problem, people were surprised. So the first barrier was, is this a problem? Yes, this is a problem. Is it in your community? Yes, it is in your community. And doing that at a time when not a lot of districts across the country were coming together at that level. But I think that one of the things about having a voice for health at the system level is someone can say, hey guys, this is what's happening. So I think that initial barrier of just spreading awareness was the first one that we encountered. And we did that right at the time that, a study came out in JAMA that showed an increase in youth opioid overdose deaths. And the most recent articulation of the Monitoring the Future study gave us more information about trends in substance use, especially that, subgroup of kids who were using opioids.
Like many students, Hayes was distantly aware of the opioid crisis. But after an overdose in his community and the response on social media, it suddenly felt personal.
I think everyone was distantly aware of the dangers of overdose and fentanyl poisoning and lacing, but hadn't been forced to confront that reality. And for me, and many students, what that looked like is, seeing Snapchat stories of test your pills, throw out your pills, be careful, y'all are loved, and trying to figure out what happened and calling people and seeing who's okay. And that forced a very candid conversation, at least among students, about the dangers of drug use and kind of also the inadequacy of drug education, where very few people really fully understood the dangers of fentanyl lacing and understood which drugs can be laced. I think that's what this, it wasn't something we were really focusing on or many people were thinking about. And now, unfortunately, it is something that is on the minds of people.
Like students, parents can sometimes underestimate the effects of the opioid crisis and can be resistant to acknowledging that it's present in their community. However, most parents are open to learning more about naloxone and how their family can be prepared.
The kind of resistance that I've seen from parents is more like, this is not a problem, this is not happening in our community. Can you show me the data that it's, impacting kids in AP classes? So I think once we push through that, I haven't seen a whole lot of resistance to, can you teach my child a life-saving skill? And I think a lot of folks, they see their kids being more independent. They see their kids maybe, next steps after high school graduation, leaving home. So preparedness maybe has outweighed the fear of what access to that particular harm reduction strategy is.
Jackson Taylor and Sujit Hedge are students in Montgomery County Public Schools, where Dr. Kapunen works, who have become involved in naloxone advocacy. As a senior, Jackson ran the student-led task force against the opioid and drug crisis. In this role, he began traveling to other schools and spreading awareness and education.
They told me how they have this huge training program, created by the state, that is the whole overdose response program. And I told them, hey, I want to kind of start teaching this to students and things like that. And around December, right around Christmas, I'd say, there was something called the Save a Student Summit. And it was the first one of these that had existed. And it was the first time in the history of the state that a student gave a presentation to other students on this whole overdose response program. And I wasn't one there doing that. And when that happened, I continued, I got a lot of great feedback from it and everything. And I got people that kept telling me, hey, can you come do this here, come do this there? So it led to me going to schools during lunches, going to events on weekends, speaking at big student leadership conferences around the state and giving this presentation to kind of help expand the knowledge on everything.
Sujit first became exposed to the opioid crisis when he began volunteering as an EMS provider, which led him to become involved in advocacy and testify to the Board of Education.
So I think the most eye-opening thing about the opioid crisis was that some people like to think that they live in very well-off communities, that they won't be affected by the opioid crisis. But the one thing I can tell you is that it's the most unexpected places. I've had overdoses that are near my high school, and my high school is in a pretty, I would say, well-off area. And to see that this is the place where I go to school, and now someone's overdosing, it's really eye-opening to realize that you may think that you're not affected by this crisis, but you definitely are in ways that you don't even know. There were definitely some things I was expecting, but I think it was, if anything, it was about the things that I wasn't expecting. So, I never thought I would get calls that are so close to my school. You don't think you will get opioid overdoses, but, then you get the call and, you see the unconscious patient. It's super close. It's a suburban area. Like I said, it just showed me that is life. Everyone is affected by this. My entire life, I've been in a pretty well-sheltered area, and to see that this is a completely other side of life that I just never realized until I got involved with EMS.
Hayes and Jackson both got involved with government to help make lasting change so that students could carry naloxone and receive training on how to use it.
So for our bill, the process with that was, A number of times we'd had employees of our school district say, we're not the right place for this, take it to the state. We're like, we will, but we want to make sure that our community is protected first. We reached out to our Representative Barbara McLaughlin, and started working on drafting up legislation for what we wanted it to say. And what we wanted was basically, essentially every single district in America right now has a de facto ban on students carrying naloxone, because they ban all medications, prescription or over the counter, unless they have an exemption from the school district. So hypothetically, I could get in trouble for having ibuprofen in my backpack. What we wanted was a state policy to create exemptions for every single non-private school in our state that said that students must be allowed to carry naloxone, and then encourage districts to educate students on the use and distribute it. We applied the same statutory language to fentanyl test strips, although we removed the encourage because that was a controversial. Encouraging districts to distribute fentanyl test strips was something that was seen as controversial by a number of our partners on this bill. We furthermore included language to encourage school bus drivers to carry naloxone, as well as some statutory updates to kind of bring state statute up to more present terms. It was an incredible process. We had a group of students testify on this issue at the State House and State Senate over Zoom. And in the end, it passed with bipartisan support. I think in the Senate, in both chambers, it passed with an immense amount of bipartisan support. It was added to the consent agenda in the Senate, and I believe had only one individual vote in opposition. The state of Colorado, not many people know this, is actually the most partisan legislature, statistically speaking. And to see our bill be able to pass with a nonpartisan support was truly incredible. I think showed the urgency and necessity of this, as well as the importance of education. We had a number of people who are representatives who originally voiced concern after listening to student testimony, after listening to public health testimony, kind of understand better why we need that. And that's one of the most important things about naloxone is we need more education so people understand that this doesn't enable drug use and it helps save lives.
Working as a page is kind of the highlight of my last kind of school year. It was a really great opportunity to kind of be there and see how legislation works and how it's passed. Us being in Maryland, we have a Democratic supermajority, and it was fun to kind of see how some people would sometimes cross lines and just how votes would lay out in the end. At the same time, I got to meet a lot of the delegates, and when I'm on the floor, they are kind of talking to them in this different nature because they see us all the time. They are always seeing the pages walk around, getting them coffee, things like that. And then I would have the opportunity to sometimes go up to them afterwards and talk to them about these ideas. And most of them usually would always listen, and they'd love to hear from it and get this kind of idea, the more younger generation's thoughts on everything. During my second week, I met up with Delegate Joe Vogel, and I had been looking at the General Assembly's website, and I had been looking every time I would get on it, I'd search for bills that involved naloxone and the opioid crisis in schools. And I realized he had a bill that was trying to expand education through K through 12. I gave him my contact information. I told him, hey, I want to help you fight for this bill. I told him what I did, and he was very interested, to say the least. And in the end of it all, I testified before the Ways and Means Committee with him and gave this huge speech about the student perspective. The delegates were genuinely receptive. It's just, should we have that safety measure in place in order to allow students to actually have help if there's an issue? And especially considering the rise in things being laced, it really didn't help. But for the most part, the delegates were receptive.
With students across the country at risk for accidental opioid overdose, the stakes are higher for drug education. Dr. Kupunen stresses a nuanced safety-first approach rather than telling students to just say no.
There's plenty of evidence that that whole approach that was popular a few decades ago didn't translate to sustainable changes in youth behavior, and like the whole package of just say no and how as a society we handled drug use and illegal drug use and what we considered criminal was not equitable and actually caused a lot of harm. So I'm an adolescent physician, and anyone who has a teenager will tell you if you tell somebody to do something, they may just do the opposite. So like just say no is kind of like I told you, because I said so. And then that's not a way that builds skill. So I have a colleague who I was just talking to, Ben Stevenson, who's head of our harm reduction unit here in Montgomery County. And he always reminds me it's prevention and harm reduction unit, Dr. K. And his approach to harm prevention, I think, is like the real way, which is you don't just reduce harm by telling kids not to do something, but you give them skills and a way and a purpose to move forward. How do I say no? How do I act safely? How do I make decisions? And why would I do all of these things, right? So the don't do this approach is like, it's not very useful. Even for youngest kids, right? Don't touch the oven. Like, do this instead. Don't stand up. Put your bottom in your chair. Like, we're constantly telling teenagers what they're doing wrong and what they shouldn't be doing. And we could use more focus on what they're doing right and how do they get to where they're going and how do they decide what that is in the context of their strengths, interests, and values.
So I think something when we talk about education that's important to remember is my generation is the COVID generation. My health was an online class that we kind of met on Zoom. It was the very beginning of the COVID pandemic and no one really knew what was happening. So my drug education was a couple videos that were probably produced before I was born. Our school tried its best during COVID, but there's only so much that can be done. I think very much in America, we still suffer from the ramifications of DARE and Officer McGruff and all of these education systems focused solely on abstinence. And I think, abstinence is a very important tenet of drug education. We cannot deny that. But at the same time, you have 1 in 5 students of the state of Colorado will have tried hard drugs before the time they graduate. That's based off of the Healthy Kids Colorado survey data that all school districts do, right? So we can't only use abstinence-based education. And I think that's something that school districts across the nation are struggling with. It's very uncomfortable to have to confront the fact that in a class of 30 students, a large portion of them will have tried hard drugs by the time they graduate. That's an uncomfortable fact. But it's a truth and it's a reality that students are living. And, I think a lot of students receive only abstinence-based drug education. And the problem is when students then eventually, unfortunately, engage in drug use, engage in substance use, people don't understand that it increases risk to mix alcohol and opioids. They don't understand, different potential substance interactions or the risk of lacing. And the problem is then these students are unprepared for these hazards. And like I said earlier, this is the scars, this is the ramifications of our society treating drug abuse as something that must be shunned and cannot be talked about. And what we need is an education system that both teaches abstinence, but also teaches students the resources that are there. It does not alienate students. It does not teach them as criminals, but shows human compassion and, provides realistic education that's, more useful and more practical for the reality that we live in.
As you've heard in this episode, students want to be involved in the solution. For solutions to reach them, their voices need to be part of the conversation.
I think it's critical and it's like central to the work, right? Nothing for us without us. This time in history is really different. I tell that to parents all the time. This is not what you remember from like movies or the 70s or the 80s or even the 90s, which were pretty bad. And the only way for us to understand what teenagers are going through and what they need is to include them in the work. They say, oh, you don't understand. And they're actually right. I'm like, you know what? You're right. I don't know what you're going through. I don't know what it is you care about. And I learned this during COVID. There was not a lot of youth-directed public health education during COVID. We rapidly turned around to communicating with kids through telehealth. And sometimes if they were really sick, they would come into our teen center. But finding out what kids knew about COVID and what they cared about and how they were experiencing it was completely different than like adults who are baking monkey bread and being lonely, right? The way that you talk to kids about safety during a time in life where like they're averse to being safe and they want to do more exploration, trying to understand what they understood when nobody was talking to them about what was going on. Like there was no way to help somebody through that without understanding what it was they knew, how do we get them to know what they need to know? How is it impacting them? And what are they ready to be able to do? Is a 14-year-old ready to respond to an overdose and administer naloxone? What are they most worried about, right? During the pandemic, and maybe this is going too far off topic, when we looked at what would compel a young person to get a vaccine or wear a mask? And it wasn't because I want to protect myself. It was things like, because, my grandma's really sick and I would do anything for my mom or my family, or, it's a peer norm and it's like really awkward when I show up and don't have my mask. I'm embarrassed. So there are different things, and they're not disingenuous or non-generous things that motivate teenagers. There are very heartfelt things that motivate them, but they're different than what motivates adults. And when adults try to solve problems, they sometimes don't even know what the right problem is, let alone what the best solutions are. And I'm not saying that it should all come from youth, but they need to be at the table. So, I have youth come to me all the time saying, I want to, be a leader in this, and this is what we should do. And we're going to present this great white paper and solution to legislator X or leader Y. And what I tell them is just come to the table where we talk about the problems, look at the data, and make the decisions, because we need your voice in how the sausage is made. But if you're over here and we're over here solving problems in silos, it's not actually going to be the most effective way to collaboratively approach a complex problem.
Students are starting to become more of a part of the conversation, but I still think a lot of it we're excluded from. I think especially when we're talking about how we're going to make these presentations or, how we're going to make these demonstrations, we're not involved in. But I think nowadays with, advocacy becoming a bigger thing for students, I think we actually are. The fact that I had the opportunity to be a part of a student-led naloxone demonstration that could be included in the health module, I think that's a big step in the right direction, because students relate more to other students. They don't like to see some adult telling them what to do. And so, if they see other students, I feel like there's more of a connection, and there's a higher chance that they'll actually retain the knowledge that we're trying to give them.
From my experience, I think adults are understanding about including the youth voice in the issue. I was never not listened to because of my age, thankfully. And if anything, I felt like it was kind of the opposite, where a lot of the adults would love to hear this youth perspective on the issue. And especially when it's kind of becoming a more youth issue with how much things are being laced and things like that. When you go out there and give them these statistics and things about how much overdoses are rising within schools, the statistics on just the overall overdose statistics within schools and things like that, and then how much things are becoming laced and how big of an issue that is becoming, they realize just how big of an issue this is for youth. And like I said again, I was never not talked to because of my age. And just all in all, I felt like it was quite the opposite, where everybody was very eager to hear what I had to say. And with the right evidence, they were definitely very understanding and wanting to help the issue, because it's an issue affecting everyone.
Hayes wants to continue his advocacy work as he goes off to college, and still thinks there's a lot of work to be done.
I would like to see more honesty and compassion. We have a system that is a remnant of a war on drugs which failed. We have a system that truly isolates individuals at a time when society must embrace them. In terms of more concrete policy, I would like to see naloxone education at every high school in America. I think, at least in many districts and many states, all students are trained in CPR. I got my CPR certification when I was a 9th grader in high school. And that's a great skill to have. It's a life-saving skill. And usage of naloxone is another life-saving skill. Unfortunately, a high school student is probably more likely to encounter a peer overdosing than a peer with a rare heart disorder who needs CPR. And it's treating naloxone with other best practice. We know as a fact that abstinence-only education for drug use fails. It's failed the students of the state of Colorado, where 1 in 5 of them will have tried hard narcotics by the time they graduate. That statistic is excluding marijuana, which is one of the most prevalent, which is, the most narcotic used in the state of Colorado. Abstinence only has failed. It's a regrettable fact, but it is a fact. And what we need to do is continue to educate students on the values and importance of abstinence while also including real life implications. And like I said earlier, carrying naloxone is a daily reminder of the dangers of fentanyl. Far better than anything we can do educating students is have them have a piece, a reminder, but at the same time empower them.
Hayes and Jackson are both heading off to college, where they hope to continue their advocacy work and continue to make change. Sujit is still in high school, where he will work to get naloxone training implemented while continuing to volunteer with EMS. Students and young people have seen firsthand the effects of this crisis, and they want to be an active part of the solution. Giving them tools like naloxone and evidence-based drug education are important steps to raising a generation who understand that they have the power to help save a life, are compassionate about opioid dependency, and knowledgeable about the risk of overdose. Thank you for listening to this episode of Countermeasures. To learn more about what Emergent is doing to help address public health challenges like the opioid crisis, visit emergentbiosolutions.com. If this episode resonated with you, consider rating and reviewing Countermeasures on your preferred podcast platform.